Welcome all to Raw Online. Today we are going to discuss the topic on aortic dissection. Okay. So as an emergency physician, stabilizing airway, breathing, circulation is very important. But at the same time, you need to identify what is exactly going wrong with the patient. And certain diseases, certain conditions will be like easy to identify. But certain conditions, especially like aortic dissection, you need to have a lot of suspicion based on the clinical history and presentation. So this is a very, very important topic. Let's concentrate on this. Overall, there's something called as the acute aortic syndromes. Basically, they are life-threatening aortic emergencies. So they are the aortic dissection, penetrating atherosclerotic ulcer, intramural hematoma, aortic aneurysmal leakage, and ruptured abdominal aortic aneurysm. So these 5 are collectively called as acute aortic syndromes. In your exam, when something is called as asked for acute aortic syndromes, you need to write about all 5. So today we'll concentrate on aortic dissection. Okay. So now the point is, who is more prone for this and how it is occurring and exactly which part of aorta, where in aorta it is occurring. Okay. So if you ask me who, then it has a bimodal age distribution. It can occur in the young and it can occur in the elderly as well. Okay. So if it's for the young, it's going to be like a connective tissue disorders like Marfan syndrome, Ehlers-Danlos syndrome. Okay. And people who are more prone are the people who used cocaine, amphetamine, bicuspid aortic valve, and prior family history, and prior cardiac surgery history. So all these people are more prone to develop a aortic dissection. Apart from this, in elderly, the atherosclerosis process, it's a risk factor. So now, coming to the question of how is it developing? You need to know that aorta consists of 3 layers. One is the intima, media, adventitia as shown in this picture. Okay. So when the blood swaps through this media and it tracks along this, then it produces aortic dissection. It can very well stay within this area or it can breach the adventitia causing leakage of blood. Okay. So the first phenomena is that when blood flows through the aorta, it can tear the intima and it can go into the media. So this is one way blood enters the media. Okay. Easy to understand. It just tears the intima and goes inside the media. This is one way. The second is there's something called as blood supply to the aorta. There are certain small blood vessels which are supplying the aorta itself. That's called vasa vasorum. So when there is an insult to this very tiny blood vessels, vasa vasorum, that is supplying the media, this media alone goes for infarction. When the media alone goes for infarction, there will be leakage of blood inside that and hematoma develops. Okay. This hematoma can expand and it can breach either the adventitia or the intima, and it can also develop a false track. So these are the 2 different ways how a blood can enter into the media. Okay. So here we'll see the aortic dissection, which is blood entering from the lumen, breaching the intima into the media. Okay. This is what we are going to see now. So this is the thing which I just explained to you now. When the blood flows, it just tears off the intima and goes into the media. Okay. So there are 3 layers: the adventitial, the outer layer, the media or the middle layer, and the inner or the intima layer. Okay. This is a self-explanatory picture. So now comes to the question, where is in the aorta, where can this aortic dissection is more common? The first area I would say is the sinotubular junction of the at the start of the ascending aorta. Okay. So this is the heart which you are seeing here, and this is the start of the aorta, and you can see the root. This is the aortic root. This root area is called as the sinus of Valsalva. Okay. Just above that is the coronary arteries which is going out, right? So this area is called as sinotubular junction, ST junction. Okay. Now the anatomy is clear. So this is the aorta and this is the heart. This is the root of aorta. This is the sinus of Valsalva, and this is the coronary arteries which is starting from the root of aorta, and this area is called as the sinotubular junction. Okay. This is a little more clearer picture. So this is aortic annulus, sinus of Valsalva, sinotubular junction. This is the ascending aorta, proximal arch, distal arch, and the descending arch. Okay. So right side goes as brachiocephalic, left goes as common carotid and subclavian. Okay. So going back to the previous slide, so the first area, if you ask me where exactly in aorta comes this aortic dissection, the most common first place will be the sinotubular junction. The second, that is around 30%, is going to be just beyond the left subclavian artery. Okay, see here, this is a subclavian artery, right? So just beyond the left subclavian, here, exactly this area, where the descending aorta meets the ascending aorta, this area, this is the second most common area where a patient can have aortic dissection.